Tracheostomy suctioning procedure. The equipment needed is as follows: a suction machine, collection bottle and tubing, a suction kit, sterile water or saline, vital sign equipment, an ambu bag, a secured E-cylinder, personal protective equipment, saline bullets, 4x4 sponges, a Yankauer style suction catheter as needed, extra gloves, and if obtaining a sputum specimen, a Lukin sputum trap. Wash your hands. Remember that proper hand washing is imperative. Wash for a minimum of 20 seconds with soap and water. Be sure and use a paper towel to shut off the faucet. Introduce yourself, ensure the patient's privacy, identify the patient, and tell them what you're going to do. Put on the appropriate personal protective equipment. This includes gloves, a gown if indicated, and a mask with a face shield if indicated. Attach the ambu bag to the E-cylinder. Dial the liter flow to 15. Assess the patient's vital signs for respiratory rate, heart rate, oxygen saturation, breath sounds, and cough effort. Ensure the bed position is in semi-Fowler's, that is, the head of the bed raised up to 30 degrees. If your patient is unconscious or unable to be placed in an upright position, position the patient flat with the head turned to the side. Turn on suction machine and adjust to 10 to 12 millimeters of mercury. Check that the suction machine is set up properly and in working order. Open suction kit. Open the sterile water or saline and pour into the provided specimen cup. Don sterile gloves. Designate a sterile and non-sterile hand. With the sterile hand, pick up the suction catheter, and with the non-sterile hand, connect to the suction machine tubing. If a sputum specimen is ordered, place Lukin's trap in the line. Turn the suction machine on with your non-sterile hand. Note, skip this step if you're using the sputum trap. Test suction by inserting the sterile catheter into the rinse cup. Occlude the port on the suction catheter with your thumb of your non-sterile hand. Next, pre-lubricate 6 to 8 centimeters of the catheter tip with sterile water or saline. Remove any humidification or oxygen delivery devices if present with your non-sterile hand. If resident requires pre-oxygenation prior to suctioning, use your non-sterile hand to deliver breaths via the ambu bag. Note, remove the sputum trap after the first suction pass before inserting catheter into the rinse cup. Gently insert the sterile catheter without applying suction into the stoma or tube until the patient coughs or resistance is felt. Pull back about 1 centimeter and apply continuous suction with non-sterile hand, and gently withdraw, slowly rotating the catheter with your fingertips. Do not occlude the airway for more than 15 seconds. Observe the amount, color, consistency of secretions, and respiratory status for changes or need for further suctioning. With your sterile hand, rinse the catheter in the sterile water or saline and repeat as needed to clear secretions. If the patient has thick secretions, instill a few drops of saline into the stoma and use your non-sterile hand to provide 2 or 3 breaths with the ambu bag before suctioning. Provide rest periods between suctioning attempts to allow for recovery of the pulse ox to the pre-suction rate. Rinse the catheter in the sterile water or saline prior to discarding. Discard your supplies according to infection control policies. If using sputum trap, cap off the top of the trap and put aside. Label the sputum container with patient's name, date, and time. Re-evaluate patient status for respiratory rate, heart rate, oxygen saturation, breath sounds, and cough effort. Remove gloves and wash hands. Reposition patient as needed. Return the patient to the previous humidification and oxygen delivery device as applicable. Document the date and time of procedure, hyperoxygenation, the amount, color, and consistency of secretions, pre- and post-breath sounds and cough effort, pre- and post-respiratory rate and oxygen saturation, patient's response to suctioning, the date and time of the collection specimen and when sent to the lab.